Hi guys, Craig from CrossFit 3 Flow. Came to Accelerate today to speak to Will. Will put up a great post on the Accelerate Instagram page about massage guns, and that was back in February. And these are the new tool on the block when it comes to looking at the evolution of rollers and balls and how we treat at home or before training. And we've definitely seen them in our gym, members bringing them in, and I have one. This is actually my Hypervolt. So what we thought we'd do is sit down and just have a quick chat about these, what they are, what they do, maybe what they don't necessarily do that you might not be aware of, and where we would recommend that they fit in like a day-to-day treatment protocol, considering, obviously Will's a physio and what he might even talk to a client about in terms of how they can use that in their rehab. So let's kick off, mate. This is kind of an extension of what's already out there, right?
It is. Yeah, it's important to understand with these new tools that are on the market that it's a process that is an old one. It's like the foam roller, the trigger ball. These are items that have been commonly used in the past to manipulate soft tissue.
Yeah.
And this is just a new way of doing that. It allows a lot more agility and versatility in the way that you do that, and you can have different heads that attach to different things. But essentially it's an adjunct therapy. These are a tool to help you manage your soft tissue. Right. So we recommend that you have a review, and you are directing this sort of treatment towards a specific impairment that has been identified by a clinical therapist, whether that's tightness in your hips, your thoracics, or a restriction in a lower part of your leg that's affecting your back. And then you can use this to complement the specific treatment that's been done for you, whether it's physiotherapy, soft tissue massage therapy, chiropractic, osteopathy. Any professional that has assessed you properly, this then becomes an adjunct to their treatment. We don't use these in the clinic because our most important tools are our hands, and we lose the tactile feedback from tissue when we're using a tool like this, and that's one of the most important things that we get.
Yeah, absolutely. So when we've seen these are out there now, and as with anything new, and there's been some very famous from our world CrossFit athletes being sponsored by these companies to use them. They could be used incorrectly. They could be way too much pressure, way too much force, way too soon after training, and just people screwing up their face in pain, but thinking that this will solve all of their problems. Let's start with that, if you don't mind, Will. In answer to that, what would you say? Let's just say, okay, we're looking at maybe using it on our quads, a very popular muscle for DOMs, through squats and cleans, snatches, etc., lunges. If you were to prescribe this for someone to, do a little bit of your work with this for your quads, what would you sort of say to them in terms of pressure or how fast and that sort of stuff?
Well, it's all individual. If referring to some of the literature, that 80 hertz has been shown to be enough to be effective in changing pain and DOMs. So you don't need to go after this, so to speak, and everyone has different thresholds for pain. You can actually do yourself a disservice by being too aggressive too quickly. If you go slowly and allow your body to get used to this, you'll actually have a better chance of down-regulating the neural system and getting some relief and change. So you need to vary the position of the joint and the length of the muscle and manipulate the head at the same time. So my advice commonly with these is to back them off and get a better result. In saying what we've already said, I have no issue with anyone using them. I think they're a wonderful adjunct to therapy, and particularly if it's going to increase compliance, then I'm all for people using them. But it's important that you are either shown how to use them by a professional and know that you can actually do yourself a disservice by over applying them, because you can actually ramp up your neural system if you're overstimulated and have the opposite effect that you're trying to achieve. And
that's a great point, and one that we've talked about before. I've talked about with Will. These types of interventions, whether it be roller in a ball, to a degree stretching, and massage guns, you're communicating with your central nervous system. You're not necessarily communicating directly with that muscle that you are on. There is a signal going to your central nervous system in order to make a change to what you're actually applying pressure to. And you're right, you can actually overstimulate it, especially if you look at training programs. Some of you might speak to your coaches about what week you're in. I know at 3Flow, we often communicate where we're at in our cycle and what we're trying to achieve on a day-by-day, week-by-week basis to complete that cycle. If you're in a high peak week where we know we're ramping up volume because we've got that far, your central nervous system is going to be highly stimulated. So the more aggressive you are, because you're feeling a lot tighter, the more you're actually going to cause a bit of a problem for yourself potentially.
Yes. Yeah. And some of the most skilled therapists can get the best results by doing quite gentle therapy in particular directions with particular pressure. And so that's why it comes back to being directed as to how to use these the best.
Yeah, that's awesome. And for us, we would normally recommend, whether it be, look, guys, if you want to use a roller, if you want to use a ball or massage tool like this, if we were looking at just before training, you know, maybe you look at the workout for that day, all right, you might have double unders or some running, you go, okay, I might just, you know, give my calves a little bit of love, so maybe about a minute. On each calf, you know, each quad, hamstring, glute, you know, pecs if we're doing some ring dips or push-ups or you know, bench or something like that. It's about a minute, just
about a minute. I think you identify the movements that are involved, so your rear chain, or if you're overhead lifting and things like that, and you can follow the line of muscles that are involved and work out kinks along that fascial chain in terms of where there may be a restriction or a sensation of restriction, so that you feel freedom of movement before you start your workout, and allowing your joints to work through their space. Then you do your active warm-up and go into it. It's a much better flow into your workout doing it that way, removing restriction of movement and activating the muscles. So only a couple of minutes, that's more than enough. There's no need to sit there and pound away at the muscles for 5-10 minutes. But you'll get a great result using it specifically and for short periods of time.
And we normally prescribe at the gym, what Will's just said, something like a minute on a muscle group. You might do some roller in, or some ball work or some massage still, etc. We will take you through a bodyweight warm-up, and then we'll introduce some light loading. So if it was Olympic lifting day, we might eventually do some empty barbell work, and then we will start the session, and then you will progressively load. Afterwards, you might again visit the massage tool or a roller, or a little bit of stretching and cool down. And I think we've seen that in the past. We've seen that's the better long-term change, rather than, like you said, we'll hammer in an area and having a short-term change, but then 24, 48, 72 hours later, you're back to where you were before because you haven't set the protocol in place of like a warm-up effectively, light load, heavy load, deload effectively.
That process has certainly been shown to be the most effective way to warm yourself into heavy lifting and dynamic work. There's less loss of power. Static stretching is going to be one of your poorest forms of warm-up technique, whereas manipulating tissue and active warm-up is going to be your best. So just making sure you have the right proportion, the right force, and the right amount before you go into activity. You'll reduce or mitigate your risks of injury as much as you can. So the 3Flow are doing a wonderful job implementing those sort of pre-activity routines.
And then if you want to use them at night, we would definitely look at a very light impact on the body, because we want to, again, not stimulate our central nervous system because we're trying to get to sleep. We want to encourage it to relax.
This is where you can do yourself. So the beauty of these things is you can use them often and regularly. So the key is not to traumatise tissue and cause bruising, bleeding, particularly if you've got a neural condition, a disc or a nerve root irritation, where there is a sensitivity, which is a lower threshold for pain. If you drive into these, you'll just make them worse. If you use these a little bit often, you'll get a much better result. So that's one benefit of these, is that you can take them anywhere, sit in your chair at home, watching TV, and you can just work away on different body parts quite easily. So they do have upside. They're obviously more expensive than a foam roller and a ball, and that's personal preference. But if it keeps you more engaged and compliant and more regular with your soft tissue maintenance, then that is definitely the recommendation for that individual.
And I would definitely encourage, from my background as not just a coach but a soft tissue therapist, and Will's as a physio and knowing physios, etc. I think Will's point at the start was really important. Learn how to use them properly and on what point of the body. Just because you've technically got a tight muscle, it might not be tight in your realm, it might be actually weak. It might be that you have an opposite muscle, which is the reason why your muscle is behaving that way. So by seeing a physio, soft tissue therapist, osteochiro, any of the allied health services that are out there in Canberra, and there's some excellent people out there, you'll get a thorough assessment and know where that could actually benefit, because the worst thing that would happen is you would spend a fair amount of money on these
Yes.
instead of a roller, not use them correctly, and then they end up at the back of your shelf like most other stuff, because they were great, they could have done a job, but they were never really applied because you just didn't know fully where they should be applied and how.
That's my take-home message for people. I get asked about these a lot, is that they're not a primary therapy, they're a piece to the puzzle. So they can fit into the program of looking after you and your specific body type and your activity goals. But if it was just this that you were relying on, without a diagnosis or direction, then it's not going to be enough, and then you may not get the value that you've used in buying it. So it's a piece to the puzzle, not a primary therapy.
If you are interested in picking these up, there are plenty online. Will you do sell a brand?
We do stock them. We have the Complex 1.0. We do have them available. There's many different ones out there, and again, it comes back to personal preference.
Yeah, awesome. All right, guys, thanks a lot for watching. Cheers.
Thanks.